can see he's got some breathing on his own, so he's not dead.
I have no experience in emergency room care or acute situations. None.
You have a pulse? I hear nothing.
The intern is like the lowest level apprentice.
They're just going to see an awful lot of patients.
Let me go see if my patient died or not.
This is the Big Easy, where it's easy to shoot people.
Every one of us is dreading Mardi Gras.
Mardi Gras!
Mayhem don't come.
And the key is to remain calm.
She can't breathe.
You can scream, you can breathe.
You know, you just can't practice medicine defensively. You're going to get sued.
Careful.
You're going to kill people.
Hey, I'm not liking this too much.
He's aspirating.
Are you trying to feel some insanity?
This is not on camera, no comment.
On Eyewitness. We'd only been filming in the accident room one day, and it was already clear that this was going to be a grueling month for the 4 interns we're following.
It ain't done! Yes. I need to put the funny, come on, move!
Not only have these new doctors just graduated from medical school,
I have no idea what I'm supposed to be doing when.
for all except one, this isn't even their specialty of choice.
Do we examine the patient in the hallway?
Heidi's going into radiology, Will, surgery, and Morella, OBGYN. Only Clay is specializing in emergency medicine.
You're going to see every unusual and bizarre element of society come through this emergency room.
But like it or not, for the next month, they're stuck in one of the busiest emergency rooms in the country.
Welcome to the accident room.
Based on all the horror stories I heard about this place, I expected it to be round-the-clock madness. But when there's nothing going on, there's nothing going on.
Tonight's Friday night, so it's supposed to be a pretty happening evening. Slow so far, but it's only 9:30. You got to give everyone time to go out and deal drugs and get in fights, and they'll probably see the ramifications of that a little later, I think.
Daddy, he's not going anywhere. He's gone to go get his stethoscope so he can listen to your chest.
Clay's not missing much. He's late tonight because his son's sick.
I'm talking to it.
Yeah, Daddy.
And that's all it is. Touched you.
I'm exhausted. All my days off, or I spend them right back at school in the hospital.
Unlike the other 3 interns, Clay has a wife and a child at home, and at times like these, it seems particularly difficult for him to juggle professional and personal life.
Little daddy kiss. Good, but big daddy kiss. Mwah. You are goofy. You are silly. There you go.
The internship year is very busy, it's very tiring. Don't have time to keep up with family and friends, and it's just frustrating.
This is like eerily quiet right now, 11 o'clock. It's calm before the storm, is what I said earlier.
I think these quiet periods in the emergency room are actually some of the most dangerous times here, because you really get lulled into this false sense of complacency. But the minute an emergency comes crashing through the door, you really have to be ready to jump immediately into crisis mode.
It's got to get busier. I mean, it's Friday night. You know, the moon's about to... It's probably a full moon pretty soon.
Room 4, someone want to activate the system, please? Yes, nurses, room 4.
Cool.
First room 4 is a 10-year-old.
10-year-old.
Who was a passenger in the car. He's got right leg hemorrhage, probably a tib fracture, vital.
10-year-old male. Unaware vehicle.
According to paramedics, this young boy was caught with another kid joyriding in a stolen car. They got into an accident, and that's why he's here.
You're all right. That's a 2. It's going to CPP, okay?
To hear a child screaming is really rough. That's probably what gets my anxiety up more than the actual physical injury, is just the pain that the patient's suffering. I can't get it to go any further. It's so, like, soft.
The
worst is over, buddy. We're gonna take care of you. You're all right. You're gonna see your mama real soon. You're right around down the right arm. 1, 2, 3.
I just got out of the trauma room where Heidi had her first room floor with a pediatric patient, and that was probably the most difficult thing I've had to film so far since I've been here. The screams of the kid were reverberating around the room and just literally burrowed into your soul.
He's got like a lot of leg deformity, and apparently the orthopedic guys can't feel a pulse, so they're going to reduce it, which means pull on it and try to put it sort of back in place. And it's gonna hurt like hell. I don't even want to be in there either. Sad to see a kid in this kind of shape.
Heidi's really feeling the pressure of dealing with her first young patient.
It's called the tunnel of death.
He's got 105 temperature, which isn't responding, isn't coming down with medicine.
Clay is also preoccupied with a young emergency patient, his son.
105 concerns me.
Half an hour ago, this place was completely empty. I'm Dr. Hoffman. I'm going to be helping take care of you, all right? You doing okay? Your leg hurts, huh? Tell me again your first name. How do you spell that?
Medjuo.
R-E? Medjury? Okay. He can't speak. I feel bad because he's got his mouth's all messed up. So he's got what we expected, a huge fibular fracture. Obviously you can see the bone is totally displaced. He's got a big break here in his fibula, which is the adjacent bone. It's also fractured. He's breathing real noisily. I think it's because he's got a lot of blood and stuff in the back of his throat. And sad to see a kid in this kind of shape.
So far, no one's come to claim Medjury, and since he's only 10 or 11 years old, Heidi's going to go see if she can track down his mother on the phone.
He's in bad condition. He's been in a car accident. He's got a broken leg, and he's lost some of his teeth, and I think he would appreciate you coming down here and holding his hand. He's pretty traumatized. He's got to go have some CAT scans. He'll probably have some kind of surgery on his leg. He's not in the greatest shape, and he's here all by himself, except for us. Is there someone else that you can find to watch your baby? She's got the room. Okay. All right. Bye-bye. His mom says, well, she can't leave the house. She has she just had a baby, and her mother's a mental patient, and she can't come down here right now. It's pretty sad. I'm sure, I mean, some people just don't have the means to come down here, or no one to help, they don't have good social support systems, and they can't come down here, but I'm sure she can find someone to take care of the child so she can come see her son who's been in a car accident. I think, I don't know, possibly why he was out stealing cars is because he doesn't have a stable home structure. That's what I'm feeling right now.
You're a winner.
Hello, this is Clayton Overton. I believe I'm returning a page for Tracy Zerwell. She's the mother of the 1.5-year-old Clay Overton.
Clay's been having a busy night too, but in the middle of it, he just got a page from his wife telling him that his son's in the emergency room of a nearby hospital.
He's had a fever the last couple of days. My wife took him into the ER, and he's got 105 temperature, which isn't responding, isn't coming down with medicines. I don't know what's going on.
Are you scared?
105 concerns me, yes.
That's your caffeine impression.
As Clayton was doing everything that he had to do for his patients, I could tell that his mind wasn't really there because he was worried about his son.
Clay wants to go see his son, and if he worked anywhere but here, he could just run over. But he has his own very sick patients who are counting on him, and he has to make sure they're covered.
He got his lumbar films, which I haven't seen, and I wrote his scripts for Percocets for him to go out on.
Clay's attending physician agrees to help out. He knows what Clay's going through because he's been there before.
It seems that the better doctor you are, the worse husband and father you are. The better husband and father you are, the worse doctor you are. And if you spend all your time trying to be a good doctor, there's no way you can give to your family life like you should. My youngest daughter called my brother-in-law daddy before she called me daddy because she saw him more. And when she finally called me daddy, she called me bye-bye daddy because that's what everybody said to me. And that's her only recollection of me was when I was leaving.
I went with Clay a couple of blocks away to the other hospital, but when I got there, they asked me to turn the camera off.
You don't have video cameras in unless it's cleared with...
So I had to wait outside while Clay checked on his son.
You still need some more x-rays. We're going to go upstairs and get some special x-rays, all right, of your head. You're doing real good, though.
Heidi has to take Marjorie up to CAT scan, where there won't be anyone around to help her out if things go wrong. So I think Heidi was pretty nervous.
This is the place, though, that all interns fear they're going to have to run a code. Just because, you know, in the middle of the night, there's only radiology technicians up here. We're the only MD usually up here. And it just takes a while to get support if you get in a bad situation. There's no nurses, so it's called the tunnel of death.
What's up? Hospital number? 7.
It's about this time when I'm starting to think, okay, hurry up, I want to get him back down there.
And we saying the same thing.
Everyone's always nervous with an even moderately unstable patient up here.
Heidi is facing a young doctor's worst fear, a sick child who's starting to crash.
He's not getting enough oxygen in his blood, and we don't know exactly why.
And Will's new patient arrives in even more serious condition.
CPR is in progress. Not much that I can see. I couldn't read the C-spine part, but head looked okay.
They returned from CAT scan without a major incident, but down in the trauma bay, Heidi noticed that Marjorie was having some trouble breathing.
He's got real labored breathing. Yep. I don't know if it's just because he can't get a lot in through his mouth and his nose. I'm going to run over to radiology then real quick.
When Heidi saw the results of the CAT scan in radiology, it became clear that Marjorie's condition was much worse than she had thought. When we got back to the trauma bay, all of the upper-level residents were surrounding Marjorie's bed, and it was clear that he had taken a drastic turn for the worse.
You don't gotta do this. Stop. You can't get loose.
He wasn't retracting this. He was not retracting in CT. No, I feel bad because he now is like turned to shit, you know? But I mean in CT.
Like this.
When we were about to get in the elevator and I listened to his lungs, I thought he had decreased breath sounds on the right, and I should have mentioned that as soon as I got down here. They noticed it before I could, but
Jamie Nelson.
I mean, it's not obvious on chest X-ray that he's got this problem. It's concerning though that he's not getting enough oxygen in his blood, and we don't know exactly why.
For medical code coming in, we'll put one over here and one in the mirror.
Down the hall, the patients keep coming. Will gets a call for his first code.
What's a code?
Just cardiac arrest, probably.
Oh, just a cardiac arrest?
Just a cardiac arrest. Respiratory pump?
We need respiratory.
Will is about to learn how to deal with somebody whose heart has stopped beating.
A 7-year-old male was at church. So all of a sudden became unresponsive.
He's in PEA.
He went right back into
Go ahead and do CPR. He's getting 1 milligram of epinephrine. CPR is in progress. He's in PEA. He has no pulse. Continue CPR after pain is going in. You have a pulse?
All right, no pulse.
PEA on the monitor. Still in PEA. Continue CPR, please. No pulse. No pulse.
No pulse.
Stop CPR and we'll check the pulse. Did we ever get that active check? You check a
It was like
carotid
180.
pulse. Getting anything?
Real low amplitude on the monitor and no pulse. So,
Okay. We're going to go ahead and call it, Peggy. Okay. Calling it. The time of death is...
Will had just lost his first patient in the accident room, but he didn't react quite the way that I thought he would.
is that hard when a patient dies?
No. Actually, I kind of fumbled it a little bit. He did fine. So what was your question?
They come and go.
Yeah.
It's part of life.
Yeah, I think that
And it's part of it comes with the territory.
Exactly. Not like we can cry, every patient that doesn't make it. It's just, I don't know. I hate to talk about that though.
Why?
Because it's just like, the image, kind of portrays, the image it kind of portrays us in. Like, we just don't care, but it's not that. It's just that we just have a job to do and we try to do our job.
Now, if the other side of the coin, though, is if this person comes in and you forget to do something, or you miss something and cause them to have a problem, that's when you feel bad.
You feel bad about that. Oh,
That's
I
when
agree
you
with
feel
that.
real
When
bad.
you screw up, when you don't do your job.
Even experienced doctors worry that they might have made a mistake when a patient goes bad. But when you're just starting out, it seems like it's just that much worse.
He's not oxygenating well, so we gotta establish an artificial airway for him.
All right, I can intubate him right now. Somebody on to please.
The kid started out being in guarded condition, now he's in critical condition. And still keep questioning, well, up at CT, how bad was he? What was his pulse ox? Should I have taken it more seriously?
Hey, I'm not liking this too much, Ed. All this blood coming back. I'm not liking this at all.
He's aspirating.
Here. Stick that in here. I don't like that at all either. That's bad. That's not good.
What do you see on the x-ray that you didn't like?
His lung is collapsed. Right upper lobes collapsed.
As Marjorie's condition goes from bad to worse, Heidi agonizes over what went wrong.
I just want to hear that he lives.
Yeah, I went over to the ER and they said you just left.
And Clay's struggling to balance his patient load with his personal crisis.
Yes, that is high, and he is tiny.
As it turned out, by the time Clay got to the other hospital, his wife had already taken his son home.
So, if they sent him home, then he's got to be well enough to go home, stable and everything. Tracy. Yeah, I went over to the ER and they said you just left. Yes, that is high, and he is tiny. But you just look at him, see how he's doing. Okay? Okay, just give me a call when you check his temperature again. Okay, bye. He's doing okay right now. The biggest thing is to just keep checking on how he's doing. All the numbers and everything. Yeah, those are bad numbers, but it's past that right now. So what do you got? What's status?
All night, I felt like Clay was completely preoccupied with his son and feeling guilty that he wasn't there. After he talked to his wife and calmed her down, he seemed to be able to get his thoughts back to his work.
You hurting anywhere?
Is this typical Friday night?
Somebody
Just
said
it's all in the
it's
last
the
half.
calm before the storm.
I know.
You jinxed us, darling.
Shame on me, I won't do that again. Did his parents show up? Sylvia or stepmother? Stepmother. Yeah. Okay. The natural mother. Couldn't make it. He might have a fracture in one of the bones in the neck, so we got to keep his head really still. So that's why the tape's holding him down. This is the tube that's going into his lungs to help him breathe. This is a tube that goes in his stomach so he can sort of pump out his stomach. Okay. We just.
Removed from the hospital.
Thank you.
Oh, I thought I got a board.
I need to sit down. Very exhausting experience tonight.
I'm applying for a new one.
I think I was sort of hard on myself. Sort of hard on myself. Wondering whether I could have foreseen this earlier, but I was just thinking that even if I noted that he was in respiratory distress before it was noted by someone else, the end result would have been the same. I mean, he had a pulmonary contusion which was ongoing and progressive, and eventually the outcome was going to be the same.
Sometimes there really isn't a lot of follow-through with the patients from the accident room. Doctors treat them just at that moment, and then they're transferred to other areas of the hospital, and often the staff never knows what happens to them.
This kid who you've never met before comes in, you're his caretaker for the night, but then you might never find out what happened.
I just want to hear that he lives. You know, I don't care if he has a limp in his leg. I just want to make sure that he lives, not paralyzed, and can breathe on his own.
Ada! All right.
Oh, God, just that fresh air feels so good. It's very nice to have some fresh, clean air, daylight, sunshine, and know that I don't have to work for 12 hours until I have to come back again. I would get a coffee, but I want to be able to sleep, so I'm just going to go coffeeless for a while. All right, see you later.
See you tomorrow.
Next time on Eyewitness. While Heidi's young patient Medjeri went on to recover, the challenges for the interns in the accident room are far from over.
They know it cannot be done that quickly, or at least I can't do it that quickly.
Clay struggles with his choice to specialize in emergency medicine.
You have a cut on the back of your head, and we're going to close it real quick with staples.
Morella gets a painful introduction to the underside of American life.
That's your boyfriend did this?
Yes.
Happy Mardi Gras!
And New Orleans gears up for the onslaught of Mardi Gras, and so does the accident room.
Basically, for us, it'll be happy.
Please help me!
There is bad things going on around here.
Please help me!
Very bad things.